Hi, my name is Rick Davis, President and CEO at RWJBarnabas Medical Center. I am so excited to announce the grand opening of our newly renovated breast center at the Barnabas Health Ambulatory Care Center in Livingston. The renovated center is designed to be more efficient, comfortable, and patient-centered. I would like to thank Minette's Angels Foundation and the Caprio family for their generous support. Our center has seamlessly integrated the state's most technologically advanced, dedicated breast MRI magnet, enabling our team to deliver comprehensive outpatient breast imaging all in one area. In addition, we have redesigned our registration area to facilitate our patient appointments, while our expert team of physicians, nurses, and technologists continue to deliver the highest quality of care that our community has come to expect. With our Center for Breast Health and Disease Management adjacent to the breast center, a smooth continuity of care is provided for patients needing additional consultation or treatment from one of our dedicated breast surgeons. Designed with our patients in mind, our goal is to exceed the individual expectations of each patient, decrease the stress commonly associated with cancer screenings, and to promote breast health and wellness.
My name is Linda Sanders. I have been the medical director of the breast center in the ambulatory care center since 2003, so it's been a long time. The dream of putting an MR magnet in the breast center has been with me for years. We started reading breast MRI as part of breast in the year 2000, so it's been 21 years since we've been doing these studies. And all these patients had to go down to the imaging center in the lower level of the ambulatory care center. But as the years have progressed, breast MRI has become a huge component of imaging in breast, as an addition to mammography, which everybody is fully aware of that modality, and breast ultrasound, which is a secondary component to breast imaging. But breast MRI over the last 2 decades has become a huge piece of evaluation of breast findings. Having a magnet in the breast center will make it so much more convenient for the patient because all of their care with respect to the breast will be happening in one place, in one centralized location. We've gotten a huge makeover. The front desk registration area is gorgeous. The breast MRI section is now attached to the breast center, and I do hope, besides the patients having the added convenience of having all their care in one spot, will be they will feel invited into the breast center because it's just that gorgeous.
Hi, I'm Michelle Blackwood. I'm the Chief of Breast Surgery at RWJBarnabas Health. I'm here today to talk to you about how excited we are with the opening of the new breast MRI in the Livingston campus in our breast center. We believe this MRI could be a game changer for our patients and their families. We know that if we find breast cancer at a much earlier state and possibly at an earlier age, then we can impact survival from breast cancer. We also know that the rates of breast cancer are really skyrocketing. 9% of all breast cancers happen in women 39 and younger. We need to be very cognizant of this and very aware of this. The problem is there's not any good screening for these patients. So what we are trying to do is identify women who are at risk for breast cancer and make sure that they're screened on a regular basis. The best breast screening for young women and premenopausal women, quite frankly, is the breast MRI. If we can find breast cancer when it's only seen on breast MRI, we have a much greater chance of curing that breast cancer. We're very grateful and excited about this new MRI machine that is available to all of our patients. It's going to help cure breast cancer, I do believe. It also is going to help screening for our high-risk patients, of which we're seeing many, many more. So today, I'm glad you could join us for the virtual opening of the new breast MRI machine on the Livingston campus in our breast center at the ACC.